That was Sabrina Carpenter with Manchild here on 102.5 Beat FM. And finally, the interview that we've been waiting for that was supposed to happen yesterday with the lovely Alice Hawamleh from 3DP for Me. Good morning, Alice.
Good morning. How are you?
Thank you so much for being so flexible and
Oh, thank
understanding.
you. Thank you. I'm excited.
I'm excited too, and so are the listeners. So, yesterday, as you know, we were off air for a whole hour, and people were listening on the app. They said, please, you have to make this interview happen. We want to learn more about 3DP for Me. And so, thankfully, you were able to come today. Thank you very much for that. So, for people who are not really familiar with it, why don't you tell us a little bit more about 3DP for Me?
3DP for me is 3D printing. Let's start. My name is Alice Hawamleh. I'm the program manager at 3DP for me. 3DP for me is 3D printing for Middle East or for me personally.
Oh, it works both ways. That's
Yeah, so
interesting.
it could be this way or this way. We're a non-profit organization registered in the US and working here in Jordan since 2021. We've started with hearing aids. We fitted 52 kids back in 2023 with hearing aids. So what we basically do, we do 3D print the mold, then assemble it to the hearing device, and fit the kids so they can hear. Um, of course, after they are having a hearing test, and the audiologist would recommend what they need to have been fitted with. Interesting is that the ear print is like a fingerprint, so it's a unique identifier per person.
I never knew that.
Yeah.
I never knew that.
So our molds, since they are 3D printed, they are basically customized per each child. Um, we do for 3D. It's interesting how you get the measurements done. So either we scan the ear, and then use this scan for designing the mold. But for children, it's better to have an impression done, since it's hard to keep them still. So you do an
Right.
impression for the ear, and then we do scan this impression, and the same scan we use it for the design, and then
The mold can
complete.
be created.
Yeah, and then attach it to the hearing aids and everything. Why children? Children grow fast. So even with all this work, every approximately 6 months, you would need to have new molds printed for them because they would outgrow the old ones.
Okay.
Last year, with the ongoing situation in Gaza, we thought of also through 3D printing to go into prosthesis. There's a massive need in Gaza. We've started with a pilot called Step by Step with 5 children in Jordan. We do not have a lot of children amputation cases, thanks God, here in
Thankfully,
Jordan.
yeah.
Yeah, but it was a learning journey to transition from the traditional way of making prostheses, which can make up to 7 days per prosthesis, to the 3D printing way, which can have prostheses being built in one day.
Oh, so much more efficient that way.
Exactly. Yeah. So, as I said, um, it was a journey for learning and also for technology transfer from the US. So, an entity there, they did the online training for our team. They do it in the US, and they have it in different 50 places. So,
Right.
trying it here, thanks God, it worked. We fitted these 5 children successfully. And so far, we've done 16 in total, mostly children.
Okay.
We do below knee prosthesis. And we've started with the above knee, so for lower limbs, not
Okay.
upper limbs.
Very
For Gaza, since it all started for Gaza, it's the idea was to have the project simple and mobile. So also interesting about 3D printing is how you take the measurements. We do it through scanning, just using an iPhone. The iPhone would scan the residual limb, and then you would have everything uploaded in the system, and you can complete doing the design and everything. So we sent an iPhone to Gaza. We partnership with ALPC, Artificial Limb and Polio Center in Gaza. We built a few prostheses, but we're still waiting for approvals to have them sent to the other side. So
Well,
keeping fingers crossed, we can do some work there as well.
hopefully you will get that approval. That is
Inshallah.
incredible
Yeah.
work that you guys are doing.
Oh,
Well,
thank you.
besides the technology transfer, which is obviously extremely valuable, what else makes 3DP for Me really unique?
Um, I would say the human touch.
Mm.
So, one of our most important values is to treasure each person and walk the extra mile.
Mm-hmm.
We do have a holistic team, a holistic care team. It's not a big team, mostly volunteers, but we follow up with the children, either the hearing aid children or the prosthetic, and their families. So, for hearing aids, now they have their hearing aids, they can hear, but can they talk?
Mm.
So, now here comes the speech therapy. And uh, beside the speech therapy, we also follow for their well-being. Last February, we had a party for these 52 children and their families. When they see other children facing the same challenges, sharing stories, you build a community.
It's
They
like a
feel we're
support
not
group,
alone.
right?
Yeah. And thanks to Dr. Muhammad Al Azza, the Secretary General for the Higher Council of for the Rights of the Persons with Disability, he had a truly inspiring speech to the children and how they should care for their future and pay attention.
Mm-hmm.
We do as well holistic care for the prosthetics patients
Mm-hmm.
because you may know they would need physiotherapy.
Right.
So they can actually use the prosthetic if their muscles are weakened, or it depends on each patient's case. Sometimes you would need psychosocial support so they can be integrated back, go back to their schools.
Go back to work or whatever the
Exactly, thrive in life.
case. Mm-hmm.
After all, they are just children. They would need to play, feel that they can do what all other kids are doing.
Exactly.
We're not a big team, but
Yeah.
we're dynamic.
Okay,
So
I
we're
was
trying
gonna
to
ask,
make it.
how
Yeah,
do you, how
we're
do you pull it off?
yeah
With
we're here we're just 12.
Mhm.
A mix of yani, locals and expats. Worldwide we're 30. But we try to make the most of what we have, like even make it fun to come to work every day.
Oh, that's good. That's
Yeah.
important. We know that that is very important.
Yeah.
Yeah.
And going back to your question,
Mhm.
like how we can make it happen, I would
Yeah.
say collaboration is the key.
Okay.
So we share the same dream with other local donors and international donors and institutions. Um, this year we fitted extra 22 new kids with hearing aids, and by 2027 we will fit another 37 kids, inshallah. Thankfully, with a grant from the HCD, the Higher Council for the Rights of the Persons with Disability. And I would like to thank His Royal Highness Prince Mirad for his support and guidance all over the way. And beside grants and donations, we have partners that share their services. So, for example, DHL helped us sponsored our second 3D printer coming all the way from the US. The printer itself was also donated. So they sponsored the shipment, and now we doubled our capacity. We can build up to a print up to 25 prosthetics per month.
Wow.
Yeah.
Wow. I mean, they say with things like this, it takes a village. But I think when the mission of what you're doing is so beautiful and profound, it's very hard for people to not want to help, you know? I mean, at the very least, what we can do is raise awareness about what you're doing so that people become more aware. But it's just such a beautiful thing and a beautiful concept that, of course, people would want to help, you know?
It's so right, and especially working with children, they're
Yeah.
so innocent, so you can actually see when they are depressed or when they are feeling bad, or the look on their faces when they can hear again, or when they can
my
walk again and
gosh.
take their other steps. So it's
I get
yeah,
those videos all the time on
yeah.
Instagram, by
It's,
the way, and it just melts my heart. And what I love, what you just said that you're doing, what makes you different than maybe any other kind of NGO like this, is you make sure to follow up.
yeah,
You're
the
not
follow up
just
is really
you're
important.
not just creating
Yeah.
it, done, check, I did it. They're wearing their hearing aid. No, you're making sure that they're good and that they're doing the necessary steps to now re-enter society or whatever the case. I think that is brilliant. That is
Oh,
beautiful.
thank you. And so far, as I mentioned, since in Jordan we don't have so many cases, and in Gaza, Syria, we're waiting for approvals. We're doing work in Syria.
Okay.
I would share a story. There's this little kid. His name is Osama. He's 7 years old. Um, they had to flee their home in their resort and living in a tent, having breakfast like any other day. After breakfast, there are 8 siblings playing. Um, what they didn't know is that the tent, unfortunately, was placed over an exploded bomb,
Oh my
and
gosh.
he lost his brother. He lost his left leg, hurt his other leg. One of the siblings also was hurt badly. When we first met him in Syria, you know, when a 7 years old, I'm a mom, so
Mm.
I can see, and you can see it. He described his feelings as helpless. You know, it's so, yani, it's really
Which it
heartbreaking.
is. Kids are.
But then scanning him, building the prosthetic, see him walk again, um, starting to be confident walking, even kicking a ball, that
Oh.
makes you wanna help more.
Of course, it's a rewarding feeling to
Uh,
see the efforts,
yeah,
manifested.
yeah, truly. And although the war in Syria is over, but there are so many landmines and unexploded bombs that the cases, especially among children with amputations, is yeah, happens
Hmm.
unfortunately every day. So we collaborated with the Ministry of Health in Syria, and we do prosthetic work at their Ibn al-Nafis hospital in Damascus. And also we partnered with SAMS, which is an international NGO, Syrian American Medical Society.
Right.
In total, we did so far 19 patients in Syria, mostly children.
Okay.
Yeah, and as I'm speaking
Excellent.
now, the
Hmm.
team are on their way to Syria to fit
Oh
even
wow.
yeah, more children that we have
Wow.
scanned last week.
That is unbelievable.
Yeah.
Well, I mean, if you reflect a little bit on all the work that you've done, what is a message that you'd like to leave with people tuned in right now on how they can make a difference?
We imagine a future when we can actually help more kids. There are so many kids in need. With the hearing aids, um, you can't imagine the impact that they have after having the hearing aids. They would go to school, but they would be completely disconnected.
Mm.
So it's as if nothing happens. Simple things that when you hear, you can't imagine, but they can't even go to a shop buy something because they can't hear the cars go by. It's hard to keep them safe.
It could be dangerous. Exactly. Yeah.
Yeah, so, and even with the prosthetics, it's not that they regain only their steps back, so even their independence. Independence is really
Of
important.
course. And that
Um,
means their confidence as well.
exactly. Yeah, like one of the boys we helped in Syria, he's a teenager and he had a bilateral amputation. So when he came, he was always in a wheelchair, always accompanied by a family member, not able to do the basic stuff. After fitting and having physiotherapy, and now he can walk. One time, by coincidence, he arrived at the same time that the team arrived. He was coming by taxi by himself, like waving from
Oh
them.
my
So you
gosh.
can see the confidence, the ability to thrive back in life and be able to have their life back. We can't do it alone. That's the message. We
Definitely
can't do
not.
it alone.
Yeah.
So we help as much as we can, but with every help from anyone who's interested and would share our dream to help kids, we definitely can help more.
All right. Well, how can they reach? How can they reach you if they'd like to help in any way? I don't know, volunteer or whatever the case.
Well, we have a website. I guess you will be sharing our website so they can
On our
see more.
Instagram story, yes.
Yeah, they can see more about what we do, and definitely they can reach us over Instagram, LinkedIn, and there's even a phone number. Um, and we're ready to explain anything more. I don't want to
Excellent.
bore you with more details,
Not
but yeah,
boring at all, by the way.
yeah,
I'm just it's a bit emotional. I mean, what you do is
yeah.
a bit emotional. I am enjoying this so much. I just want to share a message we got from our listener Hamad. He was one of the listeners that reached out
Mhm.
yesterday and said, "You got to make sure this interview happens." He says, "Good morning, Diana and Alice. I just wanted to express how much I admire the work Alice and her team are doing. Thank you for taking the initiative and covering for all of us where we may have fallen short. Diana, would it be possible to share their donation accounts on air and highlight any volunteer opportunities they might have? Perhaps we, as Beat FM listeners, we could find a way to support or collaborate with them, maybe do something in the field with them." So thank you very much, Omar. I agree. I mean,
Yeah.
if you want to say
Great
anything.
words. Thank you
Mm.
so much. Yeah,
Um,
of course, you can reach to us anytime. And on the website, we have the donation links. And also, yeah, we can be in touch.
Excellent.
Yeah.
Thank you, Omar. And thank you again, Alice Hawamleh, program manager at let me make sure I say it right.
3DP for
For
me.
me. And me could be me or it could be Middle East. I
Yeah.
love it. Alice, thank you so much. That was
Very